Welcome everyone. Thank you for joining us today. I'm Teresa Marantet, CEO and Chief Nursing Officer of the Windsor-Essex County Health Unit. Dr. Ahmed will not be joining us as he is currently on a leave of absence. Today we are reporting an increase of 39 new cases of COVID-19 in Windsor and Essex County. Of the 39 cases, 13 are close contacts of confirmed cases, 7 are related to outbreaks, 4 are community acquired, and 15 are still being investigated. We have had 13,299 cases since the beginning of the pandemic. 12,623 cases are now resolved, and 281 people are active at this time. 32 cases have been identified as variants of concern, and 1 case has been identified as the UK variant. 37 confirmed cases are currently in the hospital, and 8 people are in ICU. Our community has lost 395 people to COVID. We are reporting an additional death today. A man in his 70s from the community has passed away. 237 of these deaths have occurred among residents, staff in long-term care and retirement homes. There are currently 15 active outbreaks in Windsor and Essex County, 5 workplace outbreaks, 3 community outbreaks, 3 retirement homes, 3 school outbreaks, and 1 hospital outbreak. We are currently in phase 1 of Ontario's 3-phase COVID-19 vaccine distribution plan. Nearly 12,000 people have received their first dose of a COVID vaccine in Windsor-Essex County. We have now vaccinated, this number is wrong, but about 2,500 residents that are 80 years and older in Windsor and Essex County. For anyone born in 1941 or earlier, please use our pre-registration system by visiting our website at wechu.org or by calling 519-251-4072. We have approximately 13,884 people who have pre-registered and are over 80 years of age. Please continue to follow all public health measures. Stay home if you're sick. Limit your close contacts to your household members. Maintain a 2-meter distance from others. Wash your hands often with soap and water or use an alcohol-based hand sanitizer. Wear a non-medical mask or face covering and cover your mouth and nose with a tissue or use the inside of your elbow when you cough or sneeze. And download the COVID Exposure Alert app at canada.ca. Thank you.
We'll now take questions from the media. Is there any questions from Blackburn?
Yes, good morning, Teresa. I guess let's just start. Today marks 1 year, the anniversary of the pandemic. Talk to me a little bit about the last year, the journey we've been on, and where you think we go from here.
It has been a journey, hasn't it? I do remember a year ago because it was probably the last time I had a day off. But I can't even really comprehend where the journey we've all been on and the different impact of COVID throughout our community and different vulnerable populations, from the long-term care homes to the farm, to the farms in our area, the congregate living settings, the deaths, and it's incredible. And now we are doing the vaccine rollout very, quickly in our area. And so it's been an incredible year. I don't think I've really had a moment to even comprehend everything that has been accomplished, that we've all, lived through. I know many people have had so many hardships throughout this pandemic, and I've been fortunate enough to have a job and not have to worry about that aspect. But I know that the impacts of COVID, lockdown, everything has been an incredible hardship for so many people. And the vaccine, it is a hopeful time. Today especially, a year later today, my mother will get her vaccination, randomly chosen, and she's going to be 89 in a month, in May. And I know what she's been through, and so everyone's done a great job. And I think we have some more, we have to continue to do that work of public health measures and doing the best we can until we're vaccinated. And, there's a lot of us vaccinated, so we're heading in the right direction. I do think all of our community partners, our healthcare partners, our municipal partners have all supported every aspect of the pandemic and trying to get us all through this as a community. So more to come, but I think Windsor and Essex County, we've all done a great job under very extraordinary circumstances. And it's not quite over yet, but we're a little bit closer with the vaccine for sure.
Speaking of those appointments, you said you've got about over 13,000 people registered. Do you have an estimate of how many appointments have already been booked? How far in advance are you booking these appointments at this point?
So we're booking, I believe, about 3 days in advance right now. And so I did look at those numbers this morning. That's why I knew on my notes they're not exactly correct. So as of this morning, we had 1,900 people that have had their vaccine at the WFCU Center, and we have nearly 700 people at Leamington that have received their vaccine, and these are people over 80 years of age. So I just left a meeting where we're talking about how to, increase those numbers based on the fact that the week of March 22nd, we will get more vaccine. And so we'd like to continue to do this age group as quickly as possible with the first dose and get them vaccinated. So we're still doing the pre-registration, doing the random pull, and doing the phone calls. So that continues, but I believe they're about 3 days at the most.
Thank you.
Is there any questions from Windsor Star?
Yes, good morning, Teresa. The AstraZeneca vaccine is arriving at the local pharmacies now. Is there anything, does the health unit have any role to play in that, or is there anything you wish to tell the public about that?
So the health unit, as you know, our area has been was chosen as a pilot site for AstraZeneca and the pharmacy rollout. So we do have 57 pharmacies in our area that are participating. We are supporting them, but we're not directly involved in any of the tracking of the vaccine or storage. All of that will come directly from the ministry, which it's great. AstraZeneca is a vaccine that can be stored in regular fridge conditions of 2 degrees to 8 degrees. So it doesn't require a freezer capacity. They are using their own booking systems. So we're on the phone calls. We do fridge inspections. That's part of our role regardless of the pandemic. So all of the fridges in physician offices and in pharmacies are inspected by our nursing staff, and that work is ongoing. But overall, being designated as a pilot from our health unit perspective, we haven't had to invest a lot of resources. We do have a couple contact people that are supporting this, but the province is working directly with the pharmacist associations and using the pharmacies that were part of the flu and influenza vaccination program. So we know in our area we had over 100 pharmacies, and now we have 57 giving the COVID vaccine. So it will begin, it's already begun, the booking, it's online. I've checked out their different sites, and they're moving very quickly. So based on what we know, that they're each getting a tray, which is 500 doses, and that will really increase the access to another vaccine in our area. And with all of those pharmacies participating, that's quite a bit to add to people being vaccinated. So it's all good right now.
So on that subject, the AstraZeneca vaccine, those vaccinations targeted ages 60 to 64. the health units, vaccination clinics targeted 80 plus. For those between the ages of 65 and 80 who are still in the vulnerable category, they're standing by and they're wondering when it's going to be their turn. What can you tell them?
Well, everyone will have a turn. Everyone who wants the vaccine will have the opportunity to receive the vaccine. Windsor's a little bit ahead of other areas in the province in the fact that we will likely be finished our over 80 population, and we'll be looking at the next age categorization and also vulnerable patients and people in the community that have medical health conditions. So we will be moving through the phase, 1 priorities, then phase 2 priorities. So we'll continue to move down. I totally understand the access if you're, going based only on the age, that there is that gap between 65 and 80, but we'll get there. There will be more opportunities for vaccination, and as with everything, people have had to be patient, and those who have received a vaccine are very fortunate, and those of us that are waiting will get our turn.
Are you able to give a general estimate as to when that age group will be targeted?
I'm sorry, I didn't hear that.
Are you able to give any kind of general estimate as to when the 65 to 80 age group will be targeted for vaccination?
I believe the province, and I'll just, I'm surmising that the province will move to the next age category. So it will be, it could be like a 75 or over 70, that type of thing. I don't think they'll go right from 65 to 80. But we'll have to wait and see. We're on the calls, on these calls with the province, and because we are a little bit of ahead, a lot of the conversations continue to be about the 80 plus and not the other groups quite yet. But I'm thinking they'll go in increments from 80, and go lower.
Okay, thank you.
Is there any questions from AM 800?
Teresa, I'm not sure if you can answer this. In regards to the leave for Dr. Ahmed, in the release that was sent out this morning, it said other medical officers of health will be assisting. So will they be coming down to Windsor-Essex and assisting you and the team?
Not at this time. We have agreements with neighboring health units that when Dr. Ahmed's on vacation, he always has someone that we can consult. That's another medical officer of health if needed. And, so we will be consulting with, our local MOHs that if needed. And we are also, there's other requirements that can only be completed by a medical officer of health. And so I have access to a person that assisted us before in the pandemic. So we'll work through the next, the next little while.
And another one here for you. I don't know if you can answer this. It might be more of a board question for the board chair, but when Dr. Hyman was the medical officer of health, he had Dr. Kirk, and then when Dr. Hyman retired, Dr. Kirk had Dr. Ahmed. Is there a reason why Dr. Ahmed doesn't have an associate medical officer of health?
Well, our board has approved an associate medical officer of health, and that was, I believe, in June of 2020 at the board meeting. So we have been recruiting all this time and had some, promising candidates, but they never ended up coming to the area. So we will continue to recruit for an associate.
Thank you.
Any questions from CTV?
Yes, good morning. I'm sure you can't talk about Dr. Ahmed's leave, but can you talk about his contributions over the past year during the pandemic?
The contributions, as you know, I feel like all of you on the line today, the hours, the extensive and significant contributions, especially as a medical officer of health for an area of over 400,000 people, and with our unique circumstances, being a border city, having, nearly 10,000 agri-farm workers come to our area every, working in our, for us, for essential food delivery. And I would say that, it's been significant. There's so many things. You're making me think of like the whole past year, and I know you're asking very specifically about him and his contributions, but all I can say is that they're huge. They're significant contributions that, for the better, for decisions for our community at different times. And he's had to provide, a lot of input to the ministry about different decisions, and using all of our staff to support everything from our EPIs to our directors, our frontline staff, our managers. Everyone has contributed to this pandemic, and he has been the face of the pandemic and the decision, a lot of authority with the medical officer of health under the, statutory authorities. So the contributions as a medical officer of health are huge, and I think really, it's hard to put it into words, not only the contributions to the community, but also, what you sacrifice, on a personal level of a time with your family, the inability to do, to do things outside of this. I just know that every moment Dr. Ahmed has been accessible and available and working on the pandemic, and there's never been a downtime for Windsor. It wasn't a time where we could say, okay, let's, have a breather. It was on to the next issue, and whether it was staffing or another outbreak or, the vaccine coming, it has never let up. And I'm sure that's the same for every other health unit in the province, but that has been the reality of the past year. And we're not done yet.
Thank you. Changing gears a little, if the OHL return to play gets approved by the province, does that need the okay from the health unit as well?
If it is under the reopening, if it's approved under the Reopening Act, like in the, the regulations, then it wouldn't need the approval of the health unit. So I'd have to look to see exactly what that is. But if they adhere to all the regulations and it's allowed under, the act, then they would, it wouldn't be something the health unit would be able to, would even comment on unless there was some indication of, further, outbreaks or anything like that. But I'm not entirely clear about what's allowed in regarding the OHL.
Okay, thank you.
Is there any questions from CBC?
Hi, good morning. Teresa, are you able to speak about the details of the work that the health unit is doing to make vaccines available at family practices? Do you know which locations, or can you say which locations are involved in these discussions? So
I can tell you that we're working closely with 8 family health teams that are in Windsor and throughout the county, and the Windsor-Essex Community Health Centre, and trying to get them all onboarded with COVAX and giving them vaccination. So that'll be happening soon. A lot of these family health teams have a good client database and have access to all their clients. So I want to make sure that we're, that it actually moves forward, and then we'll announce who they are. But, there are 8 family, like right now we're working with these, I guess, team-based healthcare organizations to get them on board and get them the vaccine as soon as possible to help work through the priorities that have been identified. So it would be people over 80 and also their highest risk clients. So when we're able to, I'll share the names, but I want to make sure that they're all up and running and it's actually going to, move forward as timely as we can to, in fairness to them, if something doesn't work out, I don't want people calling them in advance and saying, oh, I hear we're able to get vaccinated here. So I know all the calls that we get and the emails, once a place is identified, they're going to be inundated with calls as well. So I think we'll want to give them the ability to be well prepared for that announcement.
Thank you. I also wanted to follow up about vaccinations for people who are experiencing homelessness. I think it was last week, Dr. Ahmed said that a plan for that was being worked on. Do you have a sense of when those vaccinations will be getting underway?
We did talk about that, and there's a lot of testing going on and a lot of work still going on with the homeless population and the outbreaks. So once we have a better discussions internally about how we can move forward with that, we'll have a team to help vaccinate. I think it's because of the people that are, that have COVID and potentially are close contacts. The vaccine really isn't for people that have the disease and that are potentially showing symptoms of COVID. So we have to be clear on who we're vaccinating. And I know that we don't have plans like today to go, or this week. This week's already, tomorrow is today, Thursday. So anyhow, this week's done and there aren't any plans this week, but I know that we want to look at all the numbers and figure out how many people would be eligible for the vaccine based on their health status.
Thank you. Any further questions from Blackburn?
No, thank you.
Windsor Star?
Teresa, I don't know if you can comment on this, but obviously the city of Windsor and the downtown mission have been at odds in recent days, and according to the latest report, 5 people tested positive because of the downtown mission defying the health order and having the homeless people shelter at the library. Is there any follow-up from this? Is there a possibility of any kind of penalty being imposed upon Mr. Ron Dunn?
I can tell you what I know today. We are working on on reviewing the plans that have been submitted to our health unit from the downtown mission, and we'll be providing further feedback on that. And we are working on a letter of understanding to outline the expectations moving forward. But we just received the plans and need a chance to review them and consult with the downtown mission and have those conversations directly.
Thank you.
Any further questions from AM 800?
Teresa, based on our numbers this week, and I know Dr. Ahmed mentioned it last week where we have to be around 23 or below, it doesn't look like Windsor-Essex is moving a stage here. Is that safe to say based on our current numbers?
Well, I can just comment on what I think, and that, yeah, based on, if you go strictly by the numbers, that's one thing, but I haven't been part of any conversations regarding staying or moving. But if we're looking strictly at the numbers, I do think our numbers are not where they should be at this time, and we may be staying, but I have had no conversations at all about movement or even remaining where we are. So.
And then one final one, going back to Maureen's first question about the 1 year mark. I know we've asked about the team and how everyone is doing. I guess for you, how are you doing this past year? Like you said, you haven't had no time off. How has the past year been for you, your family? I'm guessing very stressful and challenging at times.
you know, I think when this is all done, I'll have a minute to think about really what the year has been like. It's just been, right now it's like a blur, and it doesn't even feel like it really happened to me. I'm just wanting to do the best I can for our community, for my family, and I just hope that, you know, all the efforts of our health unit staff and managers and our board, everybody, I hope, you know, I hope our community sees that, because I know that the work we've been doing really is to minimize the impact of the pandemic. And it's, as you know, it's hard to see so many cases and so many deaths. And I think that when it's all, you know, when we all get a moment to to kind of reflect on the year, it'll be, you know, there'll be lots of emotions, but right now I just feel like I've just gone from one thing to the next and just trying to do the best I can every day. And I just want our community to be as safe as possible. And that's been our mission at the health unit. And there's so many people behind the scenes and in front of the scenes at the health unit, our staff, and everybody, all of our healthcare partners. The focus has been for our community. So I hope we, you know, see less deaths and, you know, less cases, and can move out of this and get back to what Windsor and Essex County used to be like at some point. But I don't.
Thank you.
Any further questions from CTV?
No, thank you.
CBC?
Yes, two more, please. One pharmacist has pointed out sort of a loophole in the rollout, being that anyone in the province can sign up for a vaccine at a pharmacy in Windsor-Essex, regardless of where they live. I know that the health unit's role in the rollout at pharmacies is limited, but I'm wondering what your take is on that, and whether you're aware of any provincial guidance around those circumstances.
Yes, so we have heard that the provincial, well, not specifically the pharmacy, but the provincial booking system that is being rolled out, that there likely will be the ability for other people to register. So I can assume that's what's happening with the pharmacy rollout, that some people from other areas are taking, taking appointments in a different jurisdiction. So the province will probably, look at that if they want that to continue. And I know they're wanting access for everybody, and in doing so, they do allow for people to schedule outside of their own location, their own health unit jurisdiction, or their own community.
Thank you. And earlier this week, Dr. Ahmed said that when there's an outbreak, hypothetically at a long-term care or retirement home, the health unit would exclude staff who haven't been vaccinated or were refusing the vaccine. I'm wondering if the health unit is considering excluding staff from working before an outbreak takes place.
I don't think any of that has been discussed, and we know that with practices with flu, that's one thing. With COVID, we haven't had that actual direction. So I would say we will monitor it, but it's not anything that has been a direction from the province or in any of the guidance right now. So we'll continue to follow whatever Ministry of Health direction is being provided and through their guidance documents, but that isn't anything I've seen.
Thank you.
Okay, thank you, everyone.
Thank you.
Thank you.